Bushnell Center for the Performing Arts in Hartford. This is the Black and Red. Here are your hosts, Dennis House and Rebecca Stewart.
Good evening and welcome to the 31st Black and Red, the first ever broadcast live on Newsdays.
Wasn't that open amazing? That's artwork by the remarkable Anna Weberson. We are surrounded by her remarkable artwork, and we are just so thrilled to be back here at the Bushnell Center for the Performing Arts, the first time, Dennis, since COVID. This is Harford HealthCare's signature fundraising event and so much more. The Black and Red each year, it launches a movement.
Yeah, what a wonderful crowd tonight. Tonight we celebrate the lives saved and the amazing teams behind that life-saving care. And we look at the future of cancer care.
This year, we have a very special campaign reminding you and your loved ones to get checked. We hope you will help us bring life-saving cancer screening to each and every community.
Nearly 2 million people will be diagnosed with cancer this year, but now there is more hope than ever before. New treatments, remarkable expertise, and access to leading-edge clinical trials have made a huge difference.
So many more survivors than ever before. Now, throughout the next half hour, you will hear those inspiring stories. You will meet amazing clinicians and caregivers, and we hope that you'll be inspired to get screened and help us bring screening to even more communities.
So as you know, tonight's about fighting cancer together. We are raising a record-breaking $2 million while we bring screening to every community across Connecticut. And if you want to help, all you have to do is scan the QR code right on your screen.
It is easy to do, and folks here are busy and active. We're going to head upstairs and check in with Tina Verona, live outside another theater on the second floor. Tina,
what's happening there?
Well, thanks, Rebecca. Yeah, thanks, Dennis. Thanks, Rebecca. Well, there is definitely an excitement here in the air. It is so great to be back here at the Bushnell. You can see the crowd behind me. All the guests are piling in. They're settling in for a spectacular evening ahead. And what a spectacular evening it will be. Of course, one of the highlights of tonight will be a very special performance by the alternative rock band, the Goo Goo Dolls. We're all waiting for that, me especially, very excited. We're going to have so much more from up here during this half-hour special, but for now, Rebecca, we're going to send it back to you.
Thank you, Tina. You look so beautiful tonight. Every person's story is different, and every life saved a miracle. This is one story where the team saved not one, but 2 lives.
My favorite hobby is building Legos. I have a lot of Legos around the house.
It's the perfect afternoon.
My zen is in the kitchen, cooking, so I love to feed the children. I love spending time with them.
It's like she's teaching me what she learned from her mom, so it's really cool.
Time with Mom. It's a gift, one they almost lost.
You paint it?
Always wanted another one.
In the fall of 2022, Linda and her husband John got the news that they had hoped for. They were pregnant with number 5.
This one was different from all the others.
4 months into the pregnancy, a devastating diagnosis: advanced cervical cancer.
Am I going to live? How much time do I have with my children? I had MRIs, CAT scans, and it was just a lot.
Desperate for expert care, desperate to save her baby and her own life, they transferred everything to the experts at the Helen and Harry Gray Cancer Center at Harford Hospital.
When you have a complex diagnosis, you want Hartford Hospital. Other hospitals, when they're in trouble, they come to Hartford.
The complex advanced cancer was something that few hospitals are equipped to handle. Harford HealthCare is the charter member of the Memorial Sloan Kettering Cancer Alliance, with access to leading-edge clinical trials and unparalleled expertise.
We're different. We're able to bring together many of these specialties.
They had to weigh every option because 2 lives hung in the balance.
We have wraparound services for both of those things.
There was nothing routine about this case. The standard in care, radiation, could help Mom, but would most certainly endanger the baby. It was off the table.
You can't give radiation to someone who's pregnant. And that's really the mainstay of the majority of cervical cancer treatment. So it's a very complicated problem.
I tried to allay her concerns by letting her know that we have a team that can treat her cancer, cure her cancer, but also try to minimize the short-term and the long-term side effects to her and her unborn child.
I said, I'm gonna keep this baby and go with chemotherapy.
Linda would undergo treatment many can't fathom. Chemotherapy while pregnant. 3 all-day treatments, by all accounts, grueling.
He fought with me, so that makes me fight even stronger.
January 2023. Miraculously, Linda gave birth to a beautiful, healthy baby boy.
He's my miracle. I'm thankful for all my support system because literally it's not only my own family, but the friends and family out there.
Her journey wasn't over, but now trips to the hospital with baby in tow became a celebration.
We thank them every day when we see them, come by. It's just like part of the family.
We're just able to wake up every day to see my children is what I'm blessed for. And that's what I look forward to every day.
That beautiful family. Linda's is one story. More than 200,000 people here in Connecticut are treated each and every year. She and baby Liam, of course, remind us why we are here tonight.
Well, it certainly takes a village to fight cancer, and leading that village is Harford HealthCare President and CEO Jeffrey Flaxen. Jeff, good to see you here tonight. Amazing evening, it really is. So Harford HealthCare will diagnose about 7,000 people with cancer this year alone, but not everybody has access. Why is widening that access so important to you?
Dennis, first of all, thank you for being here, and we love this partnership. I'm thrilled to be back in Harford. I'm thrilled to have 1,200 people here in the city tonight, raising awareness, raising money in support for cancer. Access to care is so crucial, and in healthcare, we have to do more to create more opportunity to meet people where they are, bring services closer to home, more accessibly, more affordably, and to do that, we have to become something very different. So what we're talking about tonight is reinventing the healthcare system to become better.
I love that approach to care. This is why we're here. What makes you so very different. And you also come in tonight with such gratitude for the team.
I'm so appreciative. Everyone who works within Harford HealthCare, we have 37,000 people who do such extraordinary work, who give so much to the community, take care of people in their most vulnerable moments. Tonight is an opportunity to celebrate healthcare heroes, the miracles they create, the work that they do. So this is a wonderful night. It's a big night of celebration, but importantly, we're making a difference and we're bringing more care to more people, and we're advocating for people to get screenings for cancer. We're going to bring it as close to home as possible. It'll be free and accessible wherever it can be to help people capture cancer as early as possible.
Amazing work by an amazing team. Jeffrey Flax, thanks so much. Now, of course, in 2014, Harford HealthCare's Cancer Institute actually made history, becoming the charter member of the Memorial Sloan Kettering Cancer Alliance, bringing the highest level of care right here to Connecticut. All of those advances have made a big difference. We now have more survivors than ever before.
Think about those advances in treatment. Last year alone, hundreds of thousands of patients had radiation, chemotherapy, infusions. But again, a reminder tonight, screening helps before that. Campaigns like Get Checked matter. Early detection improves cancer care. It does make a huge difference.
Yeah, it certainly does. In fact, think about this, Rebecca. In the 1970s, there were about 3 million people living with cancer. Compare that to today, 18 million living with a history of cancer in the United States.
That's really a victory. Tina Verona joins us now with a story about a special woman, a 5-time cancer survivor.
Yeah, Rebecca, it truly is hard to believe, and what an inspiration she is. Cancer was absolutely no match for this Simsbury woman with a very, very strong will to fight. That will and the cancer team behind her proved incredibly powerful.
Oh, it's a very good time.
It's that kind of laugh when you relive those special moments.
My daughter-in-law, Stacy.
For Michelle Potvin Piazzu, looking back is a blessing when looking forward seemed impossible.
Take me back to July 25th, 1998.
And I had just found out that I had very early breast cancer. It shook my life, it changed my life.
Cancer has been a constant in this life of yours.
Yeah, pretty much. It's been 25 years.
25 years and a 5-time survivor. From breast to lung to skin cancer, Michelle faced all of them head on.
How do you do it?
I think part of it's my family.
And the other part, her care team at the Helen and Harry Gray Cancer Center at Hartford Hospital.
You refer to your cancer team as your life jacket.
I have.
That they allow you to go swimming through life.
I swim through life knowing they've got my back.
She's one of my favorite patients.
Aside from cancer, the other more positive constant in Michelle's life has been Dr. Helene Birch.
You're still here with her.
I am still here, yeah. When you get to know someone for 25 years, you get to talk about lots of other things.
Sharing their lives during ongoing treatments.
We have really made sure that she's had good screening and been able to find these cancers early.
In fact, the team found all 5 of Michelle's cancers early thanks to screenings.
We're lucky that we have the technology and the ability to get people through these cancers.
People like Michelle. And because of that constant surveillance, the unthinkable nearly happened a 6th time.
I get a call. There's another lesion. And this is a miracle. It wasn't cancer.
It was a stunning and welcomed surprise. Yet through it all, it's Michelle's ability to laugh.
Yes.
That gets her through every time.
Cancer doesn't define who you are.
That's right. I've been afflicted by cancer. I've been affected by cancer. But I am not cancer.
Not by a long shot. Michelle's greatest challenge today? Her broken leg. After that heals, it's one step closer to making new memories. With a laugh or two along the way.
I got a lot more living to do. I'll be around for a while.
She is such an inspiration. Now, because all 5 of Michelle's cancers were found early, she never once needed chemotherapy. Just remarkable. Rebecca and Dennis, back to you.
Wow, what a story, Tina. Thank you so much for sharing that. Joining us now, we have 2 very special guests, the president of Harford Hospital, Bimal Patel, and the Cancer Institute Hartford director, Cassandra Crowell. And Bimal, we are going to kick it off with you.
And I want to ask you, let's talk about a healthcare destination. What sets Hartford apart from other places?
Absolutely. So whenever there is a destination center, the patient is in the center, all the experts come together. And when they come and surround the patient and their needs, instead of patient going from office to office, place to place, all the cares are brought to you. So they're all experts determine together what is the course of treatment, and that's what the destination center is.
Bimal, thank you.
Thanks, Bimal. And Cassandra, we've talked a lot about equity. This is a passion of Harford Healthcare, certainly of yours. What does it mean? Right now, we know that African Americans have the shortest lifespan. They don't have the survival rate. We're working hard to change that.
I'm very passionate about the work that we do in this space. Usually when African Americans show up, like myself, we have advanced disease, usually in the area of breast, prostate, and also colon, and we also die at a rate of 44% higher than our white counterparts. So there's a lot of work that we do in terms of being able to close the gaps, and one of the things that I'm very proud to talk about is the outreach program that we're able to meet patients where they are in their communities. Over the past few years, we've done more than 6,600 mammographies in the community.
Wow.
We also partner with the best, such as the American Cancer Society and also Jack's Lab.
I'm so glad to hear that. Cassandra Crowell really going out making a difference.
And Ben will tell thank you as well. Every year, Hartford Hospital and Hartford Healthcare partner with local organizations to address those disparities, like Voices of Women of Color in Hartford.
That's one of the groups that, Cassandra, you were talking about. Now, the founder of Voices, Janice Fleming, wanted to ensure that the north end of Hartford had access to mobile mammography, and what happened that day surprised her.
Harford is a melting pot of everything. And it is people that makes this city what it is today. With any relationship, trust is the foundation. And that was why the partnership for the Voices of Women of Color was so seamless, because it's about us creating safe spaces. We had a wonderful, wonderful event in North Harford and engaged the community from the bottom up and provided mammograms. I got a mammogram there as well. And it is there that the doctor found a lump in my breast, and immediately Harford HealthCare brought me in. We got it done quickly, and the lump was benign. The experience, although I was afraid, was an experience of love and care. This is why we lean on our partnership with Harford HealthCare. They're in a community. They're making sure that they let people know that they're there in the most intimate way.
Another example, screening makes a difference. Please help us make a difference. Bring screening to more people in the community. Take the time. Just scan that code right on your screen.
Now, let's get over to News 8's Lisa Carberg. She's with Mayor Luke Bronin. Lisa?
Yes, Dennis. Mayor Luke Bronin is with us this evening. Mayor, welcome, and thank you so much for being with us.
Thanks so much. It's a great night.
What does this night mean for the city of Hartford?
Well, this is a great tradition that's been going on for a long time, but of course it paused during COVID, and it's great to have this event back. But more than that, it's great to celebrate the commitment that Harford HealthCare has made to the city of Hartford. As you know, they've moved a big chunk of their operations right into downtown. We love having them there, and they've been a tremendous partner.
It must be great having all the workers downtown to infuse the city.
It makes a big difference.
All right, Hartford Mayor Luke Bronin, thank you so much for your time this evening. We appreciate it. The evening is just getting started here, and I'll send it back to you, Dennis.
All right, thanks, Lisa. There is a very important group that helps raise money every year for the hospital and the community, the Hartford Hospital Auxiliary. Tina Verona is live with the team. Hi, Tina.
Hi, Dennis. Well, the Hartford Hospital Auxiliary and the word giving really go hand in hand. I am always happy to be joined by this incredible group of women. Gretchen Haynes is the co-president. Gretchen, you had a very successful golf tournament this year, raising a lot of money for cancer. Cancer and money that is going directly back to the community. Tell us about that.
Yeah, so at our golf tournament in September, we raised about $400,000, and we gave $150,000 of that money to the Take the Time Out mobile mammography program. So we were very excited to be able to get increased access to women who might not otherwise get mammograms, hopefully improve early detection and early treatment for those women.
And give those folks a fighting chance. Thank you so much, and to everybody for all the work that you do in saving countless numbers of lives. We are grateful. We're going to send it back to you, Dennis and Rebecca.
All right, thank you, Tina. So much more to talk about tonight here, live at the Black and Red, raising money, raising awareness of cancer.
We are talking about the importance of screening and why we see more people needing screening at a younger age. We'll be right back. Welcome back to the Black and Red, Hartford Hospital's signature fundraising event.
We have a colleague, not yet 40 years old, who is proof positive that screening saves lives. Jocelyn Mementa shares his story.
Startling statistic when it comes to colon cancer and younger adults.
Younger people are being diagnosed more commonly with colon cancer. We've actually seen the rate since the mid-90s increasing by about 1% a year.
Harford HealthCare gastroenterologist Dr. Adam Schoenfeld says preventative screening is key. The gold standard, a colonoscopy.
That has been shown to significantly reduce the risk of colon cancer. And the way that it does this is actually by finding these precancerous spots called polyps that we could remove during the procedure.
Brian Spiros was 37.
So it rattled me
when he had his first colonoscopy due to a health concern.
The doctors removed 2 polyps, and they told me after that if those had stayed in there until I was the age of 50, which was the recommended age at that time to get screening, they would have most likely turned to cancer before then.
This husband and father of 2 sharing his story, reminding people about the importance of being screened. treatment. The recommended age to start getting colonoscopies recently lowered from 50 to 45. Those with a family history may need to start even earlier.
This procedure can literally save your life, and so no one should be delaying it at all.
Now 40, Brian takes us along for his second colonoscopy at the Harford HealthCare Digestive Health Center in Bloomfield. The prep the day before is pretty simple.
My doctor having me get a few over-the-counter items, including some laxative tablets, some laxative powder, and I'm gonna mix this with some Gatorade, and then we're gonna start chugging.
The next morning,
it's go time. See you on the other side.
Dr. Schoenfeld inspecting every curve and fold in the colon.
All right, that is it. Procedure is over. Just woke up feeling great. No pain, no nothing. Was in there for about 25 minutes and they did remove 2 small polyps.
Pretty amazing. We're so thankful that he was able to share that. And we want to delve into this campaign a little bit. Really, what does it mean to get checked? If you head to harfordhealthcare.org/get checked, you'll see some guidance for that screening by age.
Yeah, so what should you do in your 20s, 30s, 40s, and beyond? Well, for women, you should start screening for cervical cancer in your 20s. And now, of course, there's a vaccine.
Yes, everyone should be getting that. Listen to your doctors. Now, by 45, you should have started planning those regular skin cancer checks, mammograms, colonoscopy. And if you were a smoker, you want to be screening for lung cancer. And men, get that prostate checked.
And I've done the colonoscopies as well. We have a few more familiar faces who jumped on board getting checked.
Let's get everyone to get checked.
Have you gotten checked?
Screening saves lives.
It's time for you to get checked. Make yourself a priority and get checked. Screening saves lives.
There is more hope than ever before in cancer care. We have come so very, very far. Newer treatments, immunotherapy, much better screening tools. So much to be thankful for.
Absolutely. And joining us now to talk about advances in care is where we're headed next. Is the world-renowned Hartford Healthcare Cancer Institute's physician-in-chief, Dr. Peter Yu. Dr. Yu, thanks for being with us.
Pleasure. Thank you, Dennis. Thank you, Rebecca.
Oh, absolutely. Tell us about those advances. You've seen so much change in the years that you have been in healthcare.
No, it's amazing. I noticed it's the 75th year anniversary of Channel 8 News.
Yes.
And I think back to, 1950? Cancer was a taboo topic. You didn't mention that you had it. There was no chance of treatment or cure. And now we're totally in a different place now in the 21st century.
What do you credit with that?
Well, first of all, what is a success since I started being a cancer doctor? We've seen deaths from cancer in the United States drop by 30%. That's 30% more survivors, 30% more Americans still alive, and most of them are cured of cancer. That's a remarkable accomplishment in the last 25 years or so. How did that happen? A lot of hard work by a lot of hard people. It started really with getting the message out about cancer prevention. Stop smoking, watch your diet. Cancer screening, you just saw that segment about colonoscopies I saw. Detecting the cancer early when it's very easy to cure, may not even require surgery in the earliest stages. Avoiding chemotherapy, that was another big success. But in the last 15 years, what's really turned the corner for us is the biology of cancer, understanding the biology of cancer, and treatments that are directed to the immune system and the genetic defects that really cause cancer.
Peter Yu, amazing.
Keep up that great work. Thank you so much for being with us here, to you and your team. It's starting to get crowded in here. Look at the crowd behind us.
That's right. We're going to head upstairs and take a peek at Tina Verona and see how things are up there.
Well, Rebecca, it has truly been such a magical evening up here. We are surrounded by so much hope here, from the doctors to the nurses to the cancer teams to even the cancer survivors, all under one roof. There is so much inspiration. Right now, the guests are making their way inside Mortensen Hall, ready for the spectacular concert by the Goo Goo Dolls. That will do it for us up here for now. It has been a pleasure, and thank you for spending some time with us. And we're going to send it back to you, Rebecca and Dennis.
This is an exciting moment.
Yes, joining us now is News 8 Vice President and General Manager Rich Graziano, here with a special announcement.
Now,
hey guys.
It's time to grab it. Let's go.
All right. Well, we're just very thrilled and happy to make a presentation to Harford Hospital. This is a little bit awkward. So anyways, we're donating $7,500 from Nexstar and WTNH. We're very proud to be a part of this wonderful event. It is our 75th anniversary, thus the $7,500. And just so happy to be a part of Harford HealthCare and what they're doing. You know, making a difference in the community, helping to prevent cancer through screening in inner city communities.
And Rich, this is personal for you. This is personal for you to be here tonight.
It is. Look, it's personal for everyone if you really think about it. So many people are affected by cancer. It's in everyone's family. My dad died of colon cancer. I learned about 7 years ago that I was diagnosed with leukemia, and I was treated here at Hartford, and healthcare is top-notch. But it's really about, you know, getting awareness and prevention, and what you guys are doing to raise awareness in inner city communities is just wonderful. We're happy to be a part of it.
We have such gratitude to you.
Yes.
Thank you.
Thank you guys for everything. Lastly, I do want to thank the whole TNH team, everyone included, your team. It was great to work together, so thank you.
Thank you.
Nice work.
Thank you so much, Rich Graziano. We appreciate
thanks,
it.
Rich.
Thank you so much.
Bye,
Such a special night. We hope that you are inspired by these stories and the miracle that is cancer care.
Yeah, and we hope you're reminded to check out the guidelines, check, schedule that appointment, get that check, and of course scan that QR code.
Get checked.
We believe in a vision that will turn the 21st century into the century that is remembered as the one that cured cancer. We now understand how we can deliver cancer care. The challenge now has shifted to focusing on how we can make this care equitable. Today's generations of physicians embrace that idea. They can see the immediate impact their work has on real patients and real people. I really believe there isn't anything that we can't do if we work together.